Hey guys, Danny again with Athletes Potential. This one's for the moms. We got a couple videos that are coming out in the next couple weeks for parents, because we know oftentimes you're holding kids all day, you're chasing them around, having to pick them up. So we're going to give you some strategies to help minimize the wear and tear on your own body. Okay. So today we're talking about holding babies. And this is my baby. This is Maggie. She's 4 months old. Maggie weighs about 13-ish pounds. And oftentimes, my wife and I are having to hold Maggie pretty frequently. Most parents with young children, you'd be surprised how often you actually have to hold your kids. And 13 pounds doesn't sound like a whole lot, but when you have to hold a 13-pound baby for an hour straight, it can get pretty tiring. So we're going to relate holding a baby back to our strength and conditioning principles that we teach at our movement and mobility course with Mobility One. So anytime that our arm is forward, the corresponding rotation in the shoulder that helps create torque and stability in that joint is going to be external rotation. So we call this our front rack position. Okay, so arm forward into flexion, external rotation is a front rack position. So when we hold a baby, same thing. We want to think arm is forward, we want to create some external rotation on whatever the object is in order to keep our shoulder in a good position. So you should feel your shoulder kind of seat backward in the socket a little bit more. The other thing that I like to do is actually take my hand, whichever hand I'm holding the baby with, and actually create some tension on the opposite arm. So in order to do that, you just kind of pull on your own arm and you can create a little bit of tension or torque through your shoulder by doing that as well. All right, so the other piece that we want to see is, hey, try to hold your baby and stand in a neutral position, meaning none of this right here, okay? We don't want to be chilled out. I know I look cool right now, but for our hips and our pelvis, this is an awful position, especially for women. When they've just had their baby, they have a hormone called relaxin, which helps loosen up all the joints, especially in the pelvis, and gives it more laxity to help with childbirth. Now, that's great, but it also leaves you open to a lot of problems in your sacroiliac joint. Okay, so this is the where the sacrum and the lower back meet. Don't worry about that. We're doing it live. So that's the area where the sacrum, your lower back, and your kind of tailbone area, they meet. And we can have a lot of pain there for women that just had babies, and especially pregnant women that have this problem. And it's one-sided lower back pain. So when you shift your weight and you load that one area up, you're really creating a lot of shear force through there that's unnecessary. Okay, so I want to think, distribute your weight evenly between both legs. You have two legs for a reason. All right, so stand on both of them and try to hold your baby in that front rack position and create some tension through your shoulder. And that'll help you hold them longer without having as much pain. Okay? All right, thanks guys.